Welcome back to Central Valley Today. Our next guest is dedicated to educating the public on what's healthy and what's not healthy. Dr. Adam Rajul usually joins us every Monday to talk health and nutrition, but he's making a special appearance today on this Friday. Hello, Dr. Adam.
Hello. How are you?
I'm great. How are you doing?
Good, good.
Good. So we're going to talk about hormone therapy.
Yes,
So
yes.
first, will you just explain what that is and what's used for?
Sure. So, there's different types of hormones. The main ones are testosterone, that's the male hormone. There's estrogen, the female hormone. And then also there's different peptides you can take. Synthroid is your thyroid hormone. Today we're primarily going to be talking about testosterone.
Okay.
And then if you look at that chemical structure, it's very similar to cholesterol. It's actually made from cholesterol.
Oh.
And if you look at those, good old organic chemistry, I'm getting PTSD already, but if you look, if they're very similar, they only differ by a few hydroxyl groups. Now, the importance of this graph is to show how, if you think about cholesterol, we know that's bad, right?
Yeah.
It can increase your risk of stroke, heart disease. And testosterone is synthesized from cholesterol. So the main thing we're going to talk about today, we know testosterone can affect your skin, your immunity, your liver, but that's not what's causing issues with a lot of, especially younger people that may not need the testosterone. What's causing issues is the cardiac mortality.
Okay.
And like we talked about before, oh man, the graph's gone. It's okay, we don't need it. I would have talked about it for 45 minutes and you guys would have kicked me out before we even got to the second part. There it is, it's back. So we're not going to go through all this, but the important thing, we know testosterone can increase blood pressure. We know blood pressure is bad for the heart, right? It puts stress on the heart. Testosterone increases muscle mass. The heart's a muscle, so it actually increases the left ventricular muscle mass, and that can actually lead to heart failure. Last but not least, testosterone thickens your blood by increasing hematocrit, and that can lead to blood clots, not only in the heart, but also stroke, which is a blood clot in the brain, and also what's called pulmonary embolus, which is a blood clot in your lungs. Now, if you Google testosterone, you may see that it actually helps the heart. Those are only in patients that are low in testosterone.
Okay.
So, it's common sense, guys. If you're low in something, you need replacement. You're not going to fill your car with oil when you're running on full, right? So these patients that had a cardiac benefit, their levels were low. So I'm not really going to be, this isn't really for these patients that need that replacement. This is more for patients that maybe have normal levels, borderline low levels, and they're still taking the testosterone.
So why do people take it? Like, why is it growing?
Oh man, the juice gives you. Is
that what it is?
It gives you, energy. It helps with your libido. After age 30, your testes, they start secreting less testosterone, right? So after age 30, your testosterone literally drops a few percent every year. Oh. Some patients more, depending on their diet and their stress levels. That is normal. You do not want your grandfather having the libido he had at age 20. Like, it'd be embarrassing. They wouldn't even let him in at Target. Like, it's, you know what I mean? Like, it's not good for your body. So, the important thing is when you are seeing your doctor, make sure you're telling him all the info. Like, if you take a ton of caffeine, which is a risk factor for heart disease, if you have heart disease in your family, like we talked about before, cardiovascular disease is the #1 killer, and we're saying that this has a cardiac impact. So it's not something that's commonly discussed. We always talk about liver failure, the aggression, the acne, the baldness, but these patients that sometimes are having bad outcomes, they're not dying from baldness.
Right.
They're not dying from liver failure.
They're overdoing it from the testosterone.
Yeah, and the thing that's interesting is, historically we say, testosterone abuse. It's not necessarily abuse. Some of these patients are using it, it's prescribed, but they're not necessarily needing it.
I see.
It's funny, some patients that don't trust big pharma, they don't trust the FDA, they're okay with taking testosterone. That's like the exception. Like, oh, well, it's okay to take testosterone. I mean, it's
for their manhood.
I always say less is better. Our ancestors were not taking Ozempic. They were not taking testosterone. They were hunting with their bare hands. They were outside getting sun, and they didn't make excuses. We live in a society now where we want a magic pill, and we want it to fix everything.
We definitely do.
The older I get, the more I realize if something sounds too good to be true, and it's a shortcut, it's not worth it, because what you want is a long-term outcome, not the short-term outcome.
Do. We want to be healthy and live long. Exactly. Well, thank you so much, Dr.
Thank you.
Adam.
Thank you.
Of course.